So the procedure room is right at the front, the hallway next to the front desk. We have two procedure rooms with a small room in between them, which has all the supplies that you will need. Each procedure room will have your regular bogey over there if you want to do any cauterization during your procedure. It will have your surgical light right up here, just for your convenience. And it will, for the most part, not have a lot else. So if you need any tools or equipment that you want to use during the procedure, you'll have to get it from the middle room. Just a little hint, the surgical lights available in the procedure rooms are actually turned on by a sensor, so you just have to wave your hand in front of it and it will turn on. So as you make your way from the procedure room, there's a middle room between the two procedure rooms where you can have you will have all your equipment. So you have these little drawers underneath where you have all your kits. You have suture kits, you have circumcision kits, loop trays in case you want to insert an IUD. Preferably you wouldn't insert an IUD in the procedure room, you probably do it in the patient room just for having stirrups.
So right now I'm in between the two procedure rooms in that breezeway room where you can find a lot of the supplies you'll need. So along this wall here, for instance, you have all of these yellow folders and it's in alphabetical order, starting here and ending here. So you have things like your blackhead removers, your dilators, the mosquitoes, the needle drivers, up until the tenaculum. And all of these cupboards up here also have things you'll need for different procedures. So in here, for instance, if you have someone with MSK problems, MSK complaints, you'll have the different tensor wraps and tensor bandages. If they come in with a surgical packing or wound packing requirement, you have that here as well as different bandages and Tegaderm. And without having to open all of these cupboards, all of the contents are written on the outside.
And finally, with any procedure, like say you do a skin biopsy, whether it's a punch or like an excision, once you have your specimen and you put it in your formalin container, you need to attach along with it a pathology form. So these are the regular Hamilton Health Sciences pathology forms. You indicate the site of where the procedure was done and what your clinical diagnosis is, and you send it over. Usually it's back within 2 or 3 weeks. You also need to obtain consent before any procedure, and I would discuss that with your supervisor before you go ahead and do any consent or treatment.